My medical team betrayed my trust during surgery. Then they discovered I was the hospital's chief owner. The surgical lights blazed overhead as Dr. Marcus Chen prepared to make the first incision, unaware that the unconscious patient beneath him owned every piece of equipment in the room. Alexandra Hayes lay motionless on the operating table, her identity hidden behind a medical chart that listed her simply as A. Hayes, 34, emergency appendectomy. What the surgical team didn't know was that this woman controlled their paychecks, their careers, and ultimately, their futures. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow I've saved something extra special for you. The anesthesia had taken hold perfectly, leaving Alexandra vulnerable in ways she never could have imagined. Dr. Chen exchanged a knowing glance with his colleague, Dr. Sarah Martinez, before picking up his phone to record what would become the most expensive mistake of their careers. This wasn't going to be just any surgery. This was going to be their golden opportunity to collect evidence for the malpractice lawsuit they'd been planning for months. 3 days earlier, Alexandra Hayes had been reviewing quarterly reports in her corner office on the 20th floor of Hayes Medical Center, the premier healthcare facility she'd built from the ground up over the past decade. At 34, she was one of the youngest hospital owners in the country, having inherited a small clinic from her late father and transformed it into a sprawling medical complex that employed over 3,000 people. The irony wasn't lost on her that someone who dedicated her life to healing others was now doubled over in pain, clutching her right side as waves of agony coursed through her abdomen. She'd been ignoring the discomfort for 2 days, attributing it to stress from the upcoming board meeting where she planned to announce a major expansion project. But as she sat in her leather chair watching the city skyline blur through tears of pain, she knew this was something more serious. Alexandra had always been fiercely independent, a trait that had served her well in the cutthroat world of healthcare administration, but sometimes worked against her in personal matters. She'd built her empire by trusting her instincts and maintaining absolute control over every aspect of her business. The idea of being vulnerable, of placing her life in someone else's hands, went against every fiber of her being. Her assistant, James, had been watching her with growing concern throughout the morning. He'd worked for Alexandra for 6 years and had never seen her show weakness or allow personal issues to interfere with business. When she finally asked him to cancel her afternoon meetings and call for a car to take her to the emergency room, he knew the situation was serious. The decision to seek treatment at a different hospital across town wasn't entirely conscious. St. Catherine's Medical Center had an excellent reputation, and in her pain-addled state, Alexandra thought it might be refreshing to experience health care as a regular patient rather than the owner of a competing facility. She wanted honest, unbiased treatment without the complications that came with her position and wealth. She dressed down for the occasion, wearing simple jeans and a plain sweater instead of her usual designer suits. Her hair was pulled back in a messy ponytail, and she'd left her jewelry at home. To anyone who didn't know her personally, she looked like any other young professional dealing with a medical emergency. The $1 million watch that usually adorned her wrist remained in her office safe, along with the diamond earrings that had been her father's final gift. The emergency room at St. Catherine's was everything Alexandra had tried to avoid in her own facility: overcrowded, understaffed, and running behind schedule.
Who took her vital signs was professional but hurried, clearly dealing with more patients than the department could handle efficiently. Dr. Rebecca Thompson, the emergency physician who finally examined her, was thorough and competent. She listened to Alexandra's symptoms, performed the necessary physical examinations, and ordered blood work and a CT scan without any indication that she recognized her patient. The anonymity was exactly what Alexandra had hoped for, allowing her to focus entirely on getting the medical care she needed. The diagnosis came quickly: acute appendicitis requiring immediate surgical intervention. Dr. Thompson explained that while the condition was serious, the surgery was routine and she should expect a full recovery within a few weeks. Alexandra signed the necessary consent forms, including several documents she barely read through the haze of pain medication they'd given her for comfort. What she didn't realize was that one of those forms contained language that was highly unusual for a standard appendectomy. Buried in the fine print was a clause granting the surgical team permission to document the procedure for educational and quality improvement purposes, including video recording and detailed photographic documentation. It was a clause that Dr. Chen and Dr. Martinez had been slipping into consent forms for months as part of their elaborate scheme. The two surgeons had been planning their exit strategy from St. Catherine's for over a year. Both were talented physicians who felt undervalued and underpaid by the hospital administration. They'd watched colleagues leave for private practice or lucrative positions at other facilities, while they remained stuck in what they perceived as dead-end roles. Their plan was elegant in its simplicity: collect evidence of surgical errors, file malpractice claims, and use the settlements to fund their own private surgical center. Dr. Chen had been carefully selecting patients who fit their criteria, individuals who appeared to have limited means or support systems, making them less likely to pursue aggressive legal action if they discovered the deception. He had developed a system for identifying these patients through their insurance information and emergency contact details. Alexandra, presenting as A. Hayes with basic insurance coverage and no emergency contacts listed, seemed perfect for their purposes. The preoperative area was busy that evening, with multiple surgeries scheduled and running behind due to earlier emergencies. Alexandra was moved through the process efficiently, receiving IV fluids and additional pain medication while the surgical team prepared. She'd managed to send a quick text to James, letting him know where she was, but the medication was making her drowsy, and she didn't think to provide more details about her condition or expected timeline. Nurse Patricia Williams, who'd been working at St. Catherine's for 15 years, felt something was off about the rushed preparation for Alexandra's surgery. She had seen Dr. Chen and Dr. Martinez whispering together in the corridor, and their behavior seemed different from their usual professional demeanor. But she was dealing with her own heavy patient load and didn't have time to investigate her concerns further. As they wheeled Alexandra into the operating room, she caught a glimpse of her reflection in the polished surfaces of the medical equipment. She looked smaller somehow, diminished by the hospital gown and the vulnerability of her situation. For someone accustomed to being in complete control of her environment, the helplessness was almost as uncomfortable as the physical pain she'd been experiencing. The anesthesiologist, Dr. Kevin Park, was meticulous in his preparation, carefully calculating the appropriate dosage and monitoring Alexandra's vital signs as the medication took effect. He'd worked with Dr. Chen many times and trusted his surgical skills, but he'd also noticed some unusual requests in recent months regarding documentation and recording equipment that seemed unnecessary.
Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story.
For routine procedures, as consciousness faded, Alexandra's last coherent thought was gratitude that she'd finally sought treatment. The pain that had been her constant companion for days was about to be resolved by skilled professionals who dedicated their lives to healing. She had no way of knowing that those same professionals were about to violate her trust in the most fundamental way possible. Dr. Chen began the procedure with his usual precision, making the initial incision while Dr. Martinez positioned the recording equipment they'd concealed among the standard surgical tools. Their plan was to create minor complications during the surgery, document them thoroughly, and then use the footage as evidence of their own alleged incompetence in future legal proceedings. The appendectomy itself was progressing normally when Dr. Chen made his first intentional error. Instead of following the standard protocol for tissue removal, he deliberately nicked a small blood vessel, creating bleeding that would require additional time and intervention to control. Dr. Martinez dutifully documented the complication while secretly recording Dr. Chen's staged attempts to manage the situation. What they didn't anticipate was Nurse Williams' sharp eye and extensive experience. She'd assisted in hundreds of appendectomies and immediately recognized that Dr. Chen's technique was inconsistent with his usual skilled performance.
The bleeding he was struggling to control appeared to be the result of carelessness rather than unavoidable surgical complications. As the procedure continued, Dr. Chen introduced additional minor problems: slower than necessary suturing, unnecessary tissue manipulation, and extended surgical time that would all contribute to their documentation of substandard care. Each staged error was carefully recorded, creating what they believed would be compelling evidence for their eventual malpractice claims. Dr. Martinez played her role perfectly, asking questions and making observations that would sound appropriately concerned when reviewed later. She documented every delayed response and questionable decision, building their case with each passing minute. The recording equipment captured everything in high definition, providing the clear evidence they believed they needed for their scheme. But Nurse Williams was growing increasingly uncomfortable with what she was witnessing. Dr. Chen's explanations for the complications didn't align with her understanding of proper surgical technique, and Dr. Martinez's questions seemed designed to elicit specific responses rather than address genuine clinical concerns. She began taking her own mental notes, documenting inconsistencies she observed throughout the procedure. The surgery that should have taken 45 minutes stretched to nearly 2 hours as the doctors continued their performance. Alexandra remained stable throughout the extended procedure, but the unnecessary complications they'd created would significantly impact her recovery time and postoperative pain levels. They were treating her body as a prop in their elaborate fraud, with no consideration for the additional suffering they were causing. As Dr. Chen finally completed the appendectomy, he felt satisfied with their night's work. They'd created a solid foundation for their malpractice claim while maintaining plausible deniability about the complications they'd introduced. The recording equipment had captured everything they needed, and the patient had remained stable enough to avoid any life-threatening situations that might trigger serious investigations. Dr. Martinez carefully packed away their recording equipment while Dr. Chen completed his surgical notes, documenting the various complications and extended surgical time in language that would support their future legal claims. They'd become experts at walking the line between creating evidence and avoiding detection, or so they believed. What neither doctor realized was that their patient was about to become their biggest problem. Alexandra Hayes wasn't just another vulnerable patient with
limited resources and support systems. She was someone with the power to destroy their careers, their freedom, and their futures. The woman they'd chosen as their latest victim owned the very building where they hoped to establish their private practice. As Alexandra was moved to the recovery room, still unconscious from anesthesia, Dr. Chen and Dr. Martinez congratulated themselves on another successful evidence-gathering session. They'd added to their growing collection of staged surgical complications, bringing them closer to their goal of accumulating enough material to file multiple malpractice suits simultaneously. Their plan was to wait several months before initiating legal action, allowing time for any immediate scrutiny of their surgeries to fade. They'd file claims against the hospital's insurance company, presenting their secretly recorded footage as evidence of their own incompetence, and seeking damages for emotional distress and damage to their professional reputations. The beauty of their scheme was that they were simultaneously the perpetrators and the victims, creating evidence of malpractice while positioning themselves as whistleblowers concerned about patient safety. They'd spent months crafting their narrative, preparing explanations for why they'd remained silent about the alleged problems, and building sympathy for their difficult position as physicians caught between professional obligations and personal integrity. But as Alexandra began to regain consciousness in the recovery room, their carefully constructed plan was about to encounter its first major obstacle. The woman they'd victimized wasn't going to disappear quietly into the anonymity of the healthcare system. She was going to ask questions, demand answers, and ultimately discover the truth about what had been done to her while she lay helpless on their operating table. Nurse Williams completed her shift that night with a heavy heart, unable to shake her concerns about the surgery she'd witnessed. She'd worked with Dr. Chen for several years and had always respected his surgical skills and professional demeanor. The inconsistencies she'd observed during Alexandra's appendectomy were so out of character that she wondered if he might be dealing with personal problems affecting his performance. The recovery room staff noted that their patients seemed to be experiencing more postoperative pain than typically expected from a routine appendectomy. Alexandra's vital signs were stable, but she required higher doses of pain medication than usual, suggesting that something about her surgery had been more traumatic than necessary. The nurses attributed the complications to individual variation in healing, unaware that their patient's suffering was the direct result of deliberate surgical sabotage. As dawn broke over the city, Alexandra's absence from her office was beginning to create ripples throughout Hayes Medical Center. James had received her brief text about going to the hospital, but her failure to provide updates or respond to his follow-up messages was causing increasing concern. She had never been unreachable for this long, especially when facing important business decisions that required her immediate attention. The irony of the situation was profound. While Alexandra lay recovering from surgically inflicted complications at a competing hospital, her own medical facility was operating at peak efficiency under the temporary leadership of her assistant administrator. The systems she'd put in place were running smoothly without her direct oversight, a testament to her organizational skills and commitment to excellence in patient care. Dr. Chen and Dr. Martinez began their next day with renewed confidence in their scheme. They'd successfully added another case to their collection, and their patient had shown no signs of suspecting anything unusual about her surgery. They continued their regular duties at St. Catherine's, treating other patients with genuine care and competence, while secretly planning their elaborate exit strategy. But their satisfaction was premature. Alexandra Hayes wasn't the type of person to accept unsatisfactory outcomes without investigation, especially when those outcomes affected her personally. As she lay in her hospital bed, slowly emerging from the fog of anesthesia and pain medication, she was already beginning to ask the questions that would ultimately expose their entire operation and change their lives forever. Alexandra's eyes fluttered open to the harsh fluorescent lighting of the recovery room, her throat dry and scratchy from the breathing tube that had been removed hours earlier. The sterile smell of disinfectant filled her nostrils as she tried to orient herself to her surroundings. The pain in her abdomen was intense, far worse than she'd expected from what should have been a routine procedure. Something felt wrong, but her mind was still clouded by the lingering effects of anesthesia. A young nurse named Monica approached her bedside with a gentle smile, checking the monitors that tracked her vital signs. Alexandra attempted to speak, but her voice came out as barely a whisper. The nurse offered her ice chips and explained that the surgery had taken longer than anticipated due to some unexpected complications during the procedure. The word complications sent a chill through Alexandra's body that had nothing to do with the hospital's air conditioning. In her years of running Hayes Medical Center, she'd learned that complications during routine surgeries were often indicators of deeper problems with surgical technique, equipment failures, or inadequate preparation. Her business mind immediately began analyzing what she was being told, even as her body struggled with the aftermath of whatever had been done to her. Dr. Chen appeared at her bedside during afternoon rounds, his demeanor professional but somewhat evasive when she asked specific questions about the complications that had occurred during her surgery. He explained that there had been more bleeding than usual and some difficulty with tissue adhesions that had required additional time to address properly. His explanations sounded medically plausible, but something in his tone suggested he was withholding information. Alexandra's years of experience in healthcare administration had taught her to read between the lines when medical professionals were being less than forthcoming. She dealt with countless incidents where initial explanations evolved significantly once investigations revealed the full scope of what had actually occurred. Her instincts were telling her that Dr. Chen's account of her surgery was incomplete at best. The medication they were giving her was stronger than she'd expected, making it difficult to think clearly or ask the detailed questions she wanted answered. Every time she tried to focus on the inconsistencies in Dr. Chen's explanations, another wave of drowsiness would wash over her, forcing her back into a hazy state where forming coherent thoughts required tremendous effort.
By evening, Alexandra was becoming increasingly frustrated with her inability to get straight answers about what had happened during her surgery. The nursing staff was kind and attentive, but they seemed to know very little about the specific details of her procedure. When she asked to see her surgical notes, she was told that Dr. Chen would need to approve that request, and he wouldn't be available until the following morning. The night passed slowly, punctuated by regular visits from nurses checking her vital signs and adjusting her pain medication. Alexandra found herself lying awake during the quiet hours, replaying Dr. Chen's explanations, and trying to identify exactly what was bothering her about his account of the surgery. Her business instincts were screaming that something was amiss, but she couldn't pinpoint the source of her concern. Meanwhile, across town at Hayes Medical Center, James was growing increasingly worried about Alexandra's extended absence. He'd tried calling St. Catherine's multiple times, but patient confidentiality rules prevented the staff from confirming whether she was even at their facility. His attempts to reach her cell phone went straight to voicemail.
Failure to respond to urgent business matters was completely out of character. The next morning brought Dr. Martinez to Alexandra's bedside for what she described as a routine post-operative consultation. Her questions seemed oddly focused on Alexandra's experience during the surgery, particularly whether she recalled anything unusual or concerning about the procedure. When Alexandra mentioned her confusion about the complications that had occurred, Dr. Martinez became noticeably more interested in the conversation. Dr. Martinez explained that she was conducting a quality review of recent surgical procedures and was interested in getting patient feedback about their experiences. She asked Alexandra to describe her pain levels, her confidence in the surgical team, and whether she felt that proper protocols had been followed during her treatment. The questions struck Alexandra as unusually detailed for a routine quality assessment. Something about Dr. Martinez's manner suggested that she already knew the answers to the questions she was asking. Alexandra began to suspect that this consultation wasn't as routine as it had been presented. Her years of managing medical facilities had exposed her to various types of internal investigations, and this felt remarkably similar to the preliminary interviews that preceded more serious inquiries. When Alexandra asked Dr. Martinez directly whether there had been problems with her surgery that weren't being disclosed, the doctor's response was carefully worded but ultimately evasive. She mentioned that all surgical procedures carried inherent risks and that complications were sometimes unavoidable, even with the best medical teams. But she also suggested that Alexandra might want to request copies of all her medical records once she was discharged. The suggestion about medical records was the first concrete advice Alexandra had received since waking up, and it confirmed her growing suspicion that something significant was being concealed from her. In her experience, medical professionals only recommended that patients review their records when there were legitimate concerns about the quality of care they'd received. That afternoon, Alexandra's condition improved enough for her to make phone calls, and her first call was to James at her office. His relief at hearing her voice was palpable, but his description of the chaos her absence had created reminded her of how much her business empire depended on her constant oversight. She gave him basic information about her hospitalization, but avoided mentioning her growing concerns about the surgical complications. Her second call was to Patricia Lawson, the chief legal counsel for Hayes Medical Center. Patricia had worked with Alexandra for 8 years and had handled numerous malpractice cases, regulatory investigations, and internal quality issues. Alexandra explained her situation in general terms, but asked Patricia to quietly research Dr. Chen and Dr. Martinez to see if there had been any previous complaints or unusual patterns in their surgical outcomes. Patricia's legal background made her immediately understand the implications of Alexandra's request. She promised to conduct a discreet investigation and provide a comprehensive report within 48 hours. Her access to medical licensing databases and professional networks would allow her to uncover information that wouldn't be available to the general public. The following morning, Dr. Chen made another appearance during rounds, this time accompanied by a hospital administrator named David Walsh.
Their presence together suggested that Alexandra's case had attracted attention from the hospital's management, which was consistent with her suspicion that something unusual had occurred during her surgery. Mr. Walsh's role appeared to be damage control, as his questions focused primarily on Alexandra's satisfaction with her overall experience at St. Catherine's. He mentioned that the hospital was always looking for ways to improve patient care and was interested in her feedback about any aspects of her treatment that could be improved.
Have been handled better. Alexandra's responses were diplomatically worded, but pointed. She mentioned her concerns about the communication regarding surgical complications and her difficulty getting detailed information about what had actually happened during her procedure. She also noted that her recovery seemed to be taking longer than expected for what had been described as a routine appendectomy. The exchange with Mr. Walsh provided valuable information about the hospital's level of concern regarding her case. His presence indicated that someone in the administration was worried about potential liability issues, which suggested that her suspicions about the surgery were well-founded. The fact that they were sending administrators to manage her concerns rather than providing direct medical explanations was particularly telling. Later that day, Patricia called with preliminary findings from her research into Dr. Chen and Dr. Martinez. While both doctors had clean disciplinary records with the state medical board, Patricia had discovered some interesting patterns in their recent professional activities. Both had been involved in an unusually high number of surgeries that had experienced complications, and both had been requesting increased documentation and recording permissions for their procedures. More significantly, Patricia had learned through her professional network that both doctors had recently consulted with malpractice attorneys, allegedly seeking advice about their own potential exposure to lawsuits. The timing of these consultations, combined with the pattern of complicated surgeries, suggested a level of coordination that went beyond coincidence. Patricia's legal instincts were telling her that Alexandra had stumbled into something much larger than a single case of surgical complications. She recommended that Alexandra request immediate discharge from St. Catherine's and seek a second opinion about her surgical care from an independent medical expert who could review what had actually been done during her procedure. The suggestion to leave St. Catherine's immediately resonated with Alexandra's own instincts about her situation. She'd been feeling increasingly uncomfortable with the evasive responses she was getting from the medical staff, and Patricia's research findings provided context for her concerns. She began making preparations to discharge herself against medical advice if necessary. That evening, Nurse Williams stopped by Alexandra's room during her shift, ostensibly to check on her recovery progress. But after ensuring they were alone, she mentioned that she'd been present during Alexandra's surgery and had observed some things that concerned her about the procedure. She suggested that Alexandra might want to ask very specific questions about the surgical technique that had been used and the reasons for the extended operating time. Nurse Williams's willingness to share her concerns was the first direct confirmation Alexandra had received that her suspicions were justified. The nurse's 15 years of experience at St. Catherine's gave her observations significant credibility, and her obvious discomfort with what she'd witnessed suggested that the problems went beyond normal variations in surgical outcomes. The conversation with Nurse Williams provided Alexandra with specific areas to investigate once she obtained her medical records. The nurse mentioned that the bleeding complications had seemed inconsistent with standard surgical technique and that some of the delays during the procedure had appeared unnecessary. She also noted that the surgical team had been using recording equipment that wasn't typically present during routine appendectomies. The mention of recording equipment was particularly alarming to Alexandra, as it suggested that her surgery had been documented for reasons that hadn't been explained to her. While surgical recording wasn't uncommon for teaching purposes or quality review, it typically required specific consent and explanation, neither of which she recalled.
Receiving. Alexandra spent that night reviewing everything she could remember about the consent process she'd gone through before her surgery.
The pain medication and her urgent medical condition had made it difficult for her to carefully read all the documents she'd signed, but she was becoming increasingly certain that she hadn't been properly informed about all the procedures that would be performed. The next morning, Alexandra formally requested her complete medical records from St. Catherine's, including all surgical notes, nursing documentation, and any video or photographic materials that had been created during her treatment. The hospital's medical records department seemed surprised by the comprehensiveness of her request, particularly her specific mention of recorded materials. While waiting for her records to be prepared, Alexandra received another visit from Dr. Martinez, who seemed unusually interested in Alexandra's plans for follow-up care after discharge. When Alexandra mentioned that she would be seeking an independent medical opinion about her surgical treatment, Dr. Martinez became noticeably more nervous and began asking detailed questions about which doctors Alexandra planned to consult. The conversation with Dr. Martinez confirmed Alexandra's growing suspicion that the medical team was concerned about external scrutiny of her surgery. Their obvious anxiety about independent review suggested that they were hiding something significant about what had been done during her procedure. That afternoon, Patricia arrived at the hospital with a team of medical consultants she'd assembled to review Alexandra's case. The group included Dr. Michael Harrison, a respected surgeon with extensive experience in malpractice litigation, and Dr. Sarah Kim, a forensic medical examiner who specialized in analyzing surgical procedures for legal investigations. Dr. Harrison's initial examination of Alexandra revealed several concerning findings. Her surgical incision was larger than typically necessary for a routine appendectomy, and the pattern of her internal healing suggested that the procedure had been more invasive than standard protocols required. His preliminary assessment was that someone had deliberately complicated what should have been a straightforward surgery. Dr. Kim's review of Alexandra's post-operative symptoms and recovery timeline also raised red flags. The level of pain Alexandra was experiencing, combined with the extended healing time, was consistent with unnecessary surgical trauma that went beyond what would be expected from normal complications during an appendectomy. The medical team's findings provided expert confirmation of what Alexandra's instincts had been telling her since she'd awakened from surgery. She'd been the victim of deliberate medical malpractice, but the reasons for the sabotage remained unclear. The involvement of recording equipment suggested that her victimization had been part of a larger scheme rather than an isolated incident. Patricia's legal experience told her that they were dealing with a sophisticated fraud that had probably been ongoing for some time. The coordination between Dr. Chen and Dr. Martinez, combined with their consultations with malpractice attorneys, suggested a premeditated plan to create evidence of surgical errors for use in subsequent legal proceedings. As the scope of the conspiracy became clearer, Alexandra realized that she was probably not the first victim of their scheme. The pattern of complicated surgeries that Patricia had identified suggested that other patients had been subjected to similar treatment without their knowledge or consent. The full extent of their criminal activity was likely much larger than what had been done to her personally. The discovery that she'd been deliberately victimized while unconscious and vulnerable triggered a level of anger in Alexandra that she'd never experienced before. Her entire professional life had been dedicated to ensuring that patients received the best possible care, and the violation of that trust felt like a personal
Attack on everything she valued and believed in. But alongside her anger was a growing sense of determination to ensure that Dr. Chen and Dr. Martinez faced consequences for their actions. Her resources and connections in the medical community would allow her to conduct a thorough investigation and build an airtight case against them. They'd chosen the wrong victim for their scheme, and they were about to discover just how serious a mistake they'd made.
Patricia began coordinating with law enforcement and regulatory agencies to initiate formal investigations into the doctor's activities. The evidence they were gathering would support both criminal charges and civil litigation, ensuring that the perpetrators faced comprehensive consequences for their crimes. Meanwhile, Alexandra was making preparations to take control of the situation in ways that Dr. Chen and Dr. Martinez couldn't possibly anticipate. Her identity as the owner of Hayes Medical Center was about to become the key factor in their downfall, transforming her from a victim into the architect of their destruction. The medical team at St. Catherine's remained unaware that their patient was someone with the power to influence their careers, their freedom, and their futures. They continued treating her as just another victim of their scheme, completely oblivious to the storm that was gathering around them. As Alexandra prepared to leave St. Catherine's and begin her counterattack, she reflected on how the doctor's choice of victim would ultimately determine their fate. They deliberately targeted someone they believed to be vulnerable and powerless, but they were about to learn that appearances could be devastatingly deceiving. The next phase of her response would require careful coordination and strategic thinking, but Alexandra was confident that her resources and determination would be more than sufficient to ensure that justice was served. Dr. Chen and Dr. Martinez had violated her trust while she was helpless, but they were about to discover that their victim was far from powerless in the aftermath of their crime. The discharge process from St. Catherine's took longer than expected, with administrative delays that seemed designed to give the hospital more time to prepare for potential legal challenges. Alexandra sat in her hospital room fully dressed and ready to leave, while various staff members found reasons to extend her stay for additional observations and consultations she hadn't requested. Dr. Chen made one final attempt to control the narrative, arriving with a comprehensive discharge summary that painted her surgical complications as unavoidable consequences of her advanced appendicitis. His documentation was thorough and professionally written, but Alexandra's trained eye immediately spotted inconsistencies between his written account and the verbal explanations she'd received during her recovery. The medical records Alexandra finally received were incomplete, missing several key documents that should have been part of her surgical file. Most notably absent were the detailed operative notes that would describe the specific techniques used during her procedure, and there was no mention of the recording equipment that Nurse Williams had observed during the surgery. Patricia was waiting in the hospital lobby with a secure transport vehicle and additional security personnel when Alexandra was finally released. The legal team had determined that Alexandra's safety might be at risk once Dr. Chen and Dr. Martinez realized that their victim was conducting a serious investigation into their activities. The ride to Hayes Medical Center was Alexandra's first opportunity to see her own facility as a patient rather than an administrator. The contrast between the two hospitals was immediately apparent, from the cleaner facilities and more attentive staff to the obvious investment in advanced medical technology and patient comfort systems. Dr. Harrison was waiting in Alexandra's private medical suite at Hayes Medical Center with a team of specialists he'd convinced to intervene on Alexandra's behalf,
Assembled to conduct a comprehensive evaluation of her surgical treatment. The team included an infectious disease specialist, a forensic pathologist, and a surgical reconstruction expert who would assess the long-term implications of what had been done to her. The detailed medical examination revealed the full extent of the unnecessary trauma that had been inflicted during her surgery. Dr. Harrison's analysis showed that several procedures had been performed that weren't medically indicated for appendicitis treatment, and the surgical approach had been deliberately complicated in ways that would prolong recovery time and increase post-operative complications. Most damaging to Dr. Chen's credibility was the discovery that the bleeding complications he documented were consistent with deliberate blood vessel damage, rather than unavoidable surgical accidents. The forensic analysis showed clear evidence that arteries had been intentionally nicked and then inadequately repaired, creating the very complications that Dr. Chen had claimed were unexpected. Dr. Kim's review of the surgical timeline revealed additional evidence of deliberate sabotage. The extended operating time was the result of unnecessary procedures and deliberately inefficient techniques, rather than the complex medical conditions described in Dr. Chen's operative notes. Every delay and complication had been artificially created for reasons that had nothing to do with Alexandra's medical needs. The medical team's findings provided irrefutable evidence that Alexandra had been the victim of criminal assault disguised as medical treatment. The doctors at St. Catherine's had used her unconscious state to conduct what amounted to experimental surgery designed to create evidence for their fraudulent malpractice scheme. Patricia had been coordinating with federal investigators who specialized in healthcare fraud, and the evidence from Alexandra's medical evaluation was exactly what they needed to expand their investigation into a broader pattern of criminal activity. The FBI had been tracking unusual malpractice patterns at several hospitals, and Alexandra's case provided the missing piece that connected Dr. Chen and Dr. Martinez to a larger conspiracy. The federal investigation revealed that the two doctors had been operating their scheme for over 2 years, victimizing dozens of patients who'd been selected based on their perceived inability to challenge surgical complications or pursue legal action. The victims included elderly patients with limited family support, uninsured individuals, and people from lower socioeconomic backgrounds who were unlikely to question medical authority. Alexandra's case was unique because she had the resources and connections necessary to conduct a thorough investigation, but also because her true identity as a hospital owner made her the perfect person to understand exactly what had been done to her and why. Her expertise in healthcare administration allowed her to recognize patterns and inconsistencies that other victims might have missed. The recording equipment that had been used during Alexandra's surgery was discovered during a search of Dr. Chen's office, along with dozens of other videos documenting similar procedures performed on unsuspecting patients. The recording showed clear evidence of deliberate surgical sabotage designed to create complications that could later be presented as evidence of medical malpractice. Dr. Martinez's role in the conspiracy became clear when investigators found her detailed notes documenting each staged complication and the legal strategies they planned to use in their fraudulent malpractice claims. She had been methodically building cases against multiple hospitals while simultaneously creating the very evidence they would use to support their lawsuits. The scope of their fraud extended beyond just creating surgical complications. They had been collaborating with corrupt attorneys who would represent them in the malpractice suits, creating a network of legal and medical
professionals who were systematically defrauding insurance companies and healthcare institutions across multiple states. Alexandra's decision to reveal her true identity came during a carefully orchestrated confrontation at St. Catherine's Medical Center. She arrived unannounced with Patricia, federal investigators, and a team of medical experts, requesting an immediate meeting with Dr. Chen, Dr. Martinez, and the hospital administration. The meeting took place in St. Catherine's main conference room, with hospital executives who had no idea they were about to face the owner of their primary competitor. Alexandra waited until Dr. Chen had finished explaining his version of her surgical complications before revealing who she actually was and what she had discovered about their criminal activities. The moment of recognition was captured on the recording equipment that federal agents had installed in the conference room. Dr. Chen's face went completely pale as he realized that the victim he'd chosen for his scheme was someone with the power to destroy not only his career, but his freedom and his future. Dr. Martinez's reaction was even more dramatic, as she understood immediately that their carefully planned exit strategy had just become a pathway to federal prison. The woman they had deliberately victimized while she was unconscious and vulnerable was now sitting across from them with the evidence and resources necessary to ensure they faced the full consequences of their crimes. Alexandra's presentation to the assembled group was methodical and devastating. She walked through each piece of evidence that proved her surgery had been deliberately sabotaged, from the forensic medical analysis to the recorded conversations between the two doctors planning their fraudulent malpractice claims. The federal agents who were present immediately arrested Dr. Chen and Dr. Martinez on charges of healthcare fraud, conspiracy, and aggravated assault. The evidence Alexandra had assembled was so comprehensive that the arrests led to immediate confessions and cooperation with ongoing investigations into the broader conspiracy. St. Catherine's Medical Center faced its own legal challenges as investigators determined that hospital administrators had ignored warning signs about the doctor's unusual surgical patterns. The institution's failure to properly supervise their medical staff had enabled the conspiracy to continue for years, victimizing patients who had trusted the hospital to provide competent and ethical care. The civil litigation that followed was swift and decisive. Alexandra's legal team filed comprehensive lawsuits against both doctors, St. Catherine's Medical Center, and the network of attorneys who had been complicit in the fraudulent malpractice scheme. The damages sought included not only compensation for the medical treatment she'd required, but also punitive damages designed to send a message about the consequences of violating patient trust.
Doctors directly about the impact their crimes had on her personally and professionally. She spoke about the violation of trust that went to the heart of the doctor-patient relationship and the way their actions had undermined the integrity of the entire healthcare system. Dr. Chen received a sentence of 18 years in federal prison, reflecting both the severity of his crimes and his role as the lead surgeon in the conspiracy. His medical license was permanently revoked, ensuring that he would never again have the opportunity to victimize vulnerable patients. Dr. Martinez was sentenced to 15 years, with the difference reflecting her cooperation with federal investigators in uncovering the broader network of fraud that had been operating across multiple states. Her detailed records had helped prosecutors build cases against other participants in the conspiracy. The civil settlements reached into the tens of millions of dollars, with St. Catherine's Medical Center bearing the largest financial responsibility for their failure to prevent the criminal activity that had occurred within their facility. The hospital was required to implement comprehensive new oversight procedures and submit to federal monitoring for 5 years. Alexandra used her position as a healthcare industry leader to advocate for stronger protections for surgical patients, including mandatory recording of all procedures and independent oversight of surgical outcomes. Her experience as a victim gave her unique credibility in pushing for reforms that would prevent similar crimes from occurring in the future. The investigation into the broader conspiracy led to additional arrests and convictions across multiple states, with Alexandra's case serving as the catalyst that exposed the entire network of fraudulent activity. Over 40 medical and legal professionals were ultimately prosecuted for their roles in the scheme. The professional consequences for the convicted individuals extended far beyond their criminal sentences. Medical licenses were revoked, legal practices were disbanded, and professional reputations were permanently destroyed. The comprehensive nature of their fall from respected professionals to convicted felons served as a powerful deterrent to others who might consider similar criminal activities. Alexandra's recovery from her unnecessary surgical trauma took several months of additional medical treatment and physical therapy. The deliberate complications that had been created during her procedure required corrective surgery and extended rehabilitation, but her access to the best medical care available ensured that she eventually made a complete recovery. The psychological impact of being victimized while unconscious and vulnerable was something Alexandra addressed through counseling and therapy. The violation of trust she'd experienced went beyond the physical harm that had been inflicted, touching on fundamental questions about safety and vulnerability that affected her ability to trust medical professionals in the future. Hayes Medical Center became a model facility for patient safety and surgical oversight, implementing innovative technologies and procedures that Alexandra developed based on her experience as both a victim and a healthcare administrator. The systems she created were eventually adopted by hospitals across the country. The media attention surrounding the case led to Alexandra being recognized as a leading advocate for patient rights and healthcare reform. Her unique perspective as someone who had experienced both sides of the healthcare system gave her voice particular authority in discussions about medical ethics and patient protection. The financial damages she received from the civil litigation were donated to organizations working to improve patient safety and support victims of medical malpractice. Alexandra felt that using the money to help others who had faced similar violations of trust was the most meaningful way to honor what she had endured.
5 years after the convictions, Alexandra published a comprehensive book about her experience and the broader issues of patient safety in modern medicine.
Healthcare. The book became a bestseller and further established her as a thought leader in healthcare reform and patient advocacy. The long-term impact of the case extended throughout the healthcare industry, with medical schools incorporating Alexandra's story into their ethics curricula and professional organizations developing new guidelines for surgical oversight and patient protection. Her victimization had ultimately led to systemic changes that would protect countless future patients from similar crimes. Alexandra's relationship with James, her longtime assistant, evolved during her recovery period as she came to rely more heavily on his support and judgment in managing both her business and personal affairs. His unwavering loyalty during her ordeal strengthened their professional partnership and personal friendship. The expansion project for Hayes Medical Center that Alexandra had been planning before her surgery was completed 2 years later, with the new facilities incorporating the most advanced patient safety systems available. The project became a showcase for how healthcare facilities could prioritize patient protection while maintaining operational efficiency. Dr. Chen and Dr. Martinez remained in federal prison, with their appeals consistently denied by higher courts. The comprehensive nature of the evidence against them and the severity of their crimes made it unlikely that their sentences would ever be reduced or overturned. St. Catherine's Medical Center eventually recovered from the scandal through new leadership and comprehensive reforms, but the damage to their reputation required years of effort to repair. The case became a cautionary tale for healthcare institutions about the importance of proper oversight and the consequences of ignoring warning signs about problematic staff members. The federal task force that had investigated the conspiracy continued their work, using the patterns and methods they'd discovered to identify and prosecute similar schemes at other healthcare facilities. Alexandra's case had provided them with a template for recognizing and investigating healthcare fraud that saved countless other potential victims. Alexandra's story became a powerful reminder that appearances could be deceiving and that criminals often chose their victims based on perceived vulnerability rather than actual powerlessness. The doctors who had victimized her while she was unconscious had learned too late that their careful victim selection had led them to target someone with the resources and determination to ensure they faced the full consequences of their crimes. The legacy of Alexandra's ordeal extended far beyond the criminal convictions and civil settlements, creating lasting changes in how the healthcare industry approached patient safety and surgical oversight. Her transformation from victim to advocate had turned a personal tragedy into a catalyst for systemic reform that would protect patients for generations to come. The months following the convictions brought unexpected challenges for Alexandra as she navigated the complex aftermath of her ordeal. The public attention surrounding the case had transformed her from a relatively private business owner into a reluctant public figure, with media requests and speaking engagements consuming time she needed for her physical and emotional recovery. The corrective surgery required to address the deliberate complications from her original procedure was scheduled at Johns Hopkins Medical Center, where Dr. Elena Rodriguez, one of the country's leading surgical specialists, would personally oversee the operation. The irony of requiring additional surgery to fix what should never have been broken wasn't lost on Alexandra, but she was determined to restore her health completely. Dr. Rodriguez's preoperative consultation revealed the full extent of the damage that Dr. Chen's sabotage had caused to Alexandra's internal organs. The unnecessary trauma had created scar tissue and adhesions that would require delicate surgical intervention to correct. And there were concerns about the intent of the damage, which meant that further complications could arise during the operation. Long-term complications that might not manifest for years. The preparation for her corrective surgery was vastly different from her experience at St. Catherine's. Every aspect of the procedure was explained in detail, with multiple consultations to ensure Alexandra understood exactly what would be done and why. The transparency was therapeutic in itself, helping to rebuild her trust in the medical system that had so profoundly betrayed her. James coordinated with Alexandra's security team to ensure that news of her corrective surgery remained confidential until after her recovery was complete. The media attention surrounding the original case had made privacy a significant concern, and they wanted to avoid any disruption to her medical treatment or the hospital's normal operations. The surgical team at Johns Hopkins was aware of Alexandra's unique situation and took extraordinary precautions to document every aspect of her care. Multiple independent observers were present during the procedure, and comprehensive video recording ensured that there could be no questions about the quality and appropriateness of her treatment. Dr. Rodriguez's skill and professionalism were evident throughout the corrective procedure, which took nearly 4 hours to complete successfully. The surgeon's post-operative briefing to Alexandra's team was thorough and optimistic, indicating that the deliberate damage had been successfully repaired and that her long-term prognosis was excellent. Alexandra's recovery at Johns Hopkins proceeded smoothly, with none of the complications or extended healing time that had characterized her experience at St. Catherine's. The contrast reinforced her understanding of how dramatically her original surgery had deviated from appropriate medical standards. During her recovery, Alexandra received visits from several other victims of Dr. Chen and Dr. Martinez's scheme, many of whom had been inspired by her courage to come forward with their own experiences. These conversations were both heartbreaking and empowering, as she learned about the broader scope of suffering the two doctors had inflicted on vulnerable patients. One particularly moving visit came from Margaret Thompson, an elderly widow who had undergone what was supposed to be routine gallbladder surgery, but had experienced weeks of unnecessary complications due to Dr. Chen's deliberate sabotage. Margaret's limited resources had prevented her from investigating the problems with her surgery, and she had suffered in silence until Alexandra's case provided the framework for understanding what had happened to her. Another victim, Roberto Martinez, a construction worker without health insurance, had been subjected to Dr. Martinez's documentation scheme during emergency surgery for a work-related injury. The deliberate complications had prevented him from returning to work for months, creating financial hardship for his family that had lasted long after his physical recovery. These conversations reinforced Alexandra's determination to ensure that the victims of the conspiracy received comprehensive support and compensation for what they had endured. She worked with Patricia to establish a victim assistance fund that would provide medical care, counseling services, and financial support for those who had been harmed by the fraudulent scheme. The psychological impact of her ordeal became more apparent as Alexandra's physical recovery progressed. She found herself experiencing anxiety and hypervigilance in medical settings, even routine appointments that should have been stress-free. The violation of trust she had experienced while unconscious had created lasting trauma that required ongoing therapeutic intervention. Dr. Sarah Chen, a trauma specialist who worked exclusively with victims of medical abuse, helped Alexandra understand that her psychological response was entirely normal given the nature of her victimization. The betrayal by medical professionals had struck at fundamental assumptions about safety and trust that were
essential for functioning in society. The therapy sessions revealed layers of impact that Alexandra hadn't initially recognized. Her identity as a healthcare administrator had made the violation feel like a personal attack on her professional values and life's work. The criminals had not only harmed her physically, but had also undermined her faith in the industry she had dedicated her career to improving. Alexandra's return to active management of Hayes Medical Center was gradual and carefully planned. She began with limited hours and gradually increased her involvement as her physical stamina improved and her confidence in her decision-making abilities returned. The support from her staff during this transition period was overwhelming and deeply appreciated. The implementation of new patient safety protocols at Hayes Medical Center became Alexandra's primary focus as she resumed her leadership role.
The systems she developed were based not only on best practices from the medical literature, but also on her personal understanding of how vulnerable patients could be victimized by those entrusted with their care. The new protocols included mandatory recording of all surgical procedures, independent oversight of operating rooms, and comprehensive background checks for all medical staff. Patient advocates were assigned to every surgical case, ensuring that someone was always present to protect the patient's interests during vulnerable moments. Alexandra also instituted a whistleblower protection program that encouraged staff members to report concerns about colleague behavior without fear of retaliation. The program was designed to create multiple pathways for identifying problematic patterns before they could harm patients, addressing the institutional failures that had allowed Dr. Chen and Dr. Martinez to operate undetected for so long. The financial investment required to implement these comprehensive safety measures was substantial, but Alexandra considered it a necessary cost of maintaining the highest standards of patient care. The improvements also served as a competitive advantage, attracting patients who valued the additional protections and transparency. The media attention surrounding Alexandra's case led to speaking engagements at medical conferences across the country, where she shared her experience as both a victim and a healthcare administrator. Her presentations were powerful and well-received, contributing to broader discussions about patient safety and the need for systemic reforms. One particularly impactful speaking engagement was at the annual conference of the American Hospital Association, where Alexandra addressed over 2,000 healthcare executives about the lessons learned from her ordeal. Her presentation focused on the institutional changes needed to prevent similar crimes and the importance of creating cultures that prioritized patient protection above all other considerations. The response from the healthcare community was overwhelmingly positive, with many institutions reaching out to Alexandra for consultation on implementing similar safety measures at their own facilities. Her expertise as both a victim and an administrator gave her unique credibility in advising other healthcare leaders about protecting their patients and institutions. Alexandra's advocacy work expanded beyond healthcare settings to include testimony before congressional committees considering legislation to strengthen patient protection laws. Her firsthand experience with medical abuse provided compelling evidence for the need for federal oversight and stronger penalties for healthcare professionals who violated patient trust. The legislative hearings were emotionally challenging for Alexandra, requiring her to relive traumatic experiences in a public forum while maintaining the composure necessary to be an effective advocate. The support from other victims and patient advocacy organizations helped her navigate these difficult but important public appearances. The congressional testimony led to the passage of comprehensive patient protection legislation that included many of the systemic changes Alexandra had advocated for.
Reforms Alexandra had advocated for during her recovery. The new laws established federal standards for surgical oversight, mandatory reporting requirements for unusual complication patterns, and enhanced penalties for healthcare fraud. Alexandra's personal relationships were also affected by her ordeal and the public attention that followed. Some friendships deepened as people rallied to support her during her recovery, while others became strained by the media scrutiny and the demands of her advocacy work. She learned to appreciate the people who stood by her during the most difficult period of her life. Her relationship with her staff at Hayes Medical Center evolved as well, with many employees expressing increased loyalty and respect for her courage in confronting the criminals who had victimized her. The shared commitment to patient safety that emerged from her experience created a stronger organizational culture and sense of purpose. The financial settlements from the civil litigation were substantial enough to fund Alexandra's victim assistance program for decades, ensuring that other victims of medical abuse would have access to the resources they needed for recovery. The program became a model for similar initiatives at other healthcare institutions across the country. Alexandra's book about her experience became a bestseller and was translated into multiple languages, spreading awareness about medical abuse and patient rights to international audiences. The royalties from the book sales were donated to patient advocacy organizations, further extending the impact of her story. The tour required Alexandra to travel extensively and share her story with diverse audiences, from medical students to patient advocacy groups. Each speaking engagement was an opportunity to educate people about the importance of patient rights and the need for vigilance in protecting vulnerable individuals from abuse. The international attention led to additional opportunities to influence policy at the international level, contributing to World Health Organization guidelines for patient safety and medical ethics. Alexandra's unique perspective as both a victim and a healthcare leader gave her voice particular authority in these global discussions. The ongoing therapy and support groups that Alexandra participated in during her recovery became a permanent part of her self-care routine. She found that helping other victims of medical abuse was therapeutic for her own healing process, creating a positive cycle of support and recovery. The support groups also provided valuable insights into the long-term impacts of medical abuse, information that Alexandra incorporated into her advocacy work, and the
Victim assistance program she funded, understanding the diverse ways that medical trauma affected different individuals, helped her design more comprehensive and effective support services. Alexandra's romantic relationships were complicated by her public profile and the trauma she had experienced. The vulnerability required for intimate relationships was challenging after being victimized while unconscious and helpless, requiring patience and understanding from potential partners. Eventually, Alexandra found love with Dr. Michael Harrison, the surgeon who had been part of her medical evaluation team during the investigation. Their shared understanding of healthcare and patient advocacy created a strong foundation for their relationship, and Michael's respect for her experience and recovery process made him an ideal partner. Their wedding was a private ceremony attended only by close friends and family, but it represented an important milestone in Alexandra's recovery and her ability to trust again. The relationship provided emotional support for her continued advocacy work while maintaining the privacy she valued. The 10th anniversary of her ordeal prompted Alexandra to reflect on the profound changes in her life and the healthcare industry that had resulted from her experience. The systemic reforms that had been implemented based on her advocacy had prevented countless other patients from experiencing similar victimization. The anniversary also marked the establishment of the Alexandra Hayes Institute for Patient Safety, a research and education center dedicated to developing new approaches to protecting vulnerable patients. The institute brought together medical professionals, legal experts, and patient advocates to address emerging threats to patient safety. Dr. Chen and Dr. Martinez remained in federal prison, with their earliest possible parole dates still years away. Periodic updates on their incarceration served as reminders that justice had been served, but Alexandra found that her focus had shifted from punishment of the perpetrators to prevention of future crimes. The impact of Alexandra's story continued to ripple through the healthcare industry, with new generations of medical students learning about her case as part of their ethics education. The lessons from her experience had become integrated into medical training programs, ensuring that future doctors understood the consequences of violating patient trust. St. Catherine's Medical Center had undergone comprehensive reforms and leadership changes following the scandal, eventually regaining its reputation through demonstrated commitment to patient safety and transparency. The institution's transformation served as a model for how healthcare facilities could recover from serious ethical failures through genuine reform efforts. The federal task force that had investigated the conspiracy continued their work, using the methods and patterns identified through Alexandra's case to uncover and prosecute similar schemes at other healthcare facilities. Their ongoing efforts had prevented numerous other victims from experiencing the kind of abuse that Alexandra had endured. Alexandra's testimony in subsequent criminal cases involving medical abuse provided powerful evidence about the long-term impacts of such crimes on victims. Her willingness to share her experience helped prosecutors secure convictions and appropriate sentences for other healthcare professionals who had violated patient trust. The Victim Assistance Fund that Alexandra had established grew through donations from grateful patients and healthcare institutions, allowing it to expand services and reach more victims of medical abuse. The fund's comprehensive approach to supporting victims became a model for similar programs in other countries. The technological innovations that Alexandra had championed for surgical oversight were adopted by hospitals worldwide, creating new standards for transparency and accountability in operating rooms.
The system she had developed saved countless patients from experiencing the kind of abuse that Alexandra had endured.
Complications due to negligence or malicious intent. Alexandra's transformation from victim to advocate had created lasting changes that extended far beyond her personal recovery. Her courage in confronting the criminals who had victimized her had sparked a global movement for patient protection that continued to grow and evolve with each passing year. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.